Welcome to Dan ARG YouTube. Apostle Alfred Oyinosa, the man where they talk about CB, they with Dr. Rock Amego. They talk about healthcare insurance agency, where they for Edo State. Make I leave you, make you hear from Apostle Alfred Oyinosa and Dr. Rock Amego. Enjoy the video.
Let's go. All right, my people, una good morning, good afternoon, good evening. My name is Apostle Alfred Odion Oyinosa. The man with the talk and the do and the show as they be. Tell friend truth in not this boyfriend. Community where good people keep quiet and Robert will become general overseer. Remember, what is not good is bad. We carry waka come Edo Health Insurance Commission this afternoon or this evening to come meet the Oga to give us more update about the work when they do for Edo. Remember, say, my name is Apostle Alfred Odion Oyinosa, the street commissioner. Maga, good afternoon, sir.
Good afternoon, sir.
How are you, sir?
Fine, very fine. Thank you.
So, make you introduce yourself to our people. Oh.
Okay, thank you, team. Go and verify. My name is Dr. Rock Amego. I'm the Director General of the Edo State Health Insurance Commission.
Director General, Edo State Health Insurance Commission. So, Oga, we don't follow up your activities for Edo, and we also discover say so many healthcare center. Now don't they renovate them, now don't they build them, and some area people also they ask question how they want to take enroll into this insurance, who will cover, who will not cover. Now say today, me I carry waka come meet you, the DG, make you explain to Edo people.
Thank you very much for this beautiful question. A lot of people don't they ask us, say this health insurance. Now only for those where they work for civil service. Sometimes, in fact, last time we go radio service, they say now for only elite. But I've come to say now that the health insurance is for everybody.
Wow.
All right. In the spirit of health insurance, in fact, when we started this health insurance, Governor Obaseki was more interested for those who are poor. And that's why we started the program. So we started it in 2019 by sending it into law first to the House of Assembly. And that's in 2019 I was employed. All right, so when we started, we say, okay, for those, since we are practicing a social health insurance scheme, we say, okay, we go determine what civil servants go to contribute from their salary. And because in our health, if you look at the tenets of government, fundamental is security and welfare. And of course, health falls into welfare. We can say, okay, now we will deduct from salary, government will also they pay 50% of whatever they contribute. So we now engaged a foremost actuaries called Ernst & Young in 2019. Okay. They now came down with percentage we will deduct from civil servants and public servants and say government will also pay that type of co-contribution. Okay. So what we are doing in Edo State now, government pays 50% of healthcare for every civil and public servant, covering their father, mother, and 4 children less than 18 years of age. We've been doing it for the past 2 years now, and we have about 136,000 beneficiaries on the scheme as at today.
Wow.
We cover from eye care to surgical care to dental care to specialist care. All right, and in the nearest future, we hope that we're able to cover ambulance care or emergency service, so that when people are sick, we'll figure carry them from their house to area where they'll figure treat them.
Wow, you just talk about something, say ambulance care. We discover, say for Edo right now, we not get ambulance with a station for different place in case of emergency. So you get plan, this commission get plan for those kind of things. When it be say, they'll say one ambulance go there for Luku, for example, one go there for Bobaha, one go there for Ego. So that in case of any emergency, you just call, man, they just answer. I don't know whether I get plan for this thing.
So the plans that we have for the emergency ambulance system is one that is very robust. And again, we say we are given direction by the governor in his intelligence and his beauty of administration. If you don't look the way Uber service they operate for this country, Uber and Bolt, I mean, they came and they swept over the former taxi services. Everybody now, even when you go to a different state, you want to use Uber, you don't need to call your friend to come and pick you because Uber and Bolt services are available. And so in the spirit of that, we looked at what other countries were doing. Kenya, for example. They brought in ambulance from private sector and public sector. As we speak, presently, Edo State government has over 20 ambulances in its purview. But then we also have Keke and Pep ambulances that we also purchased some time ago. We also have about 60 of that one. We have also spoken to private care people who also get their ambulance. So what we want to do is that the software to run this program, just the way Bolt and Uber they run, we're going to bring all this capital investment together to reduce the cost of government. So that when we bring this ambulance together, we'll get control and call center room. We will tell you, say, X amount of ambulance free. Now this ambulance don't go local. This one did this one did that. We'll first start in 3 local governments to pilot the program. so that, you know, the ambulance service will be divided across the drivers, the emergency operator where they inside, and then the areas where they go. We'll start with areas that are easy to reach, where you get good motorable places, see how the thing they run, then put a price to it so that it will be sustainable. After we run that for 3 months, then we'll now expand it across the whole state in Edo State. And don't also forget that it's not every call out that person must carry. Sometimes person call you, if you get one simple headache, or if you tell and say a home remedy go do, and the person doesn't have to be transported to the hospital. So we are looking at the framework that guides that. And good to know now, our chairman of the board of directors at the primary health agency is the #1 emergency expert in Nigeria. His name is Dr. Philip Ogedegbe. And so we are working with him to institutionalize the framework where ambulance service go to work, so that the drivers and even the private and public ambulance are already there. We'll have a financing mechanism to make sure these things are sustainable, so that when we don't come out, when Governor Obaseki regime don't come out, people will still sustain the ambulance services, and we'll prevent avoidable death, you know, by bringing that ambulance service into fruition.
Wow. Thank you very much, sir. As you they talk, so many things just the fly come my brain. Now I go also ask you, major market for Edo, not just Benin City, across Edo. This major market, una get plan to get emergency units for those major markets. Maybe a person where they sell, they just fall. Maybe person where they come by, he fall. Una get plan to take arrest that kind of situation under Edo State Health Insurance Commission.
Okay, so one of the things we are doing now presently is that we are setting up offices across the 3 senatorial districts. All right, we are presently in our regional office in Ekpoma and also in Auchi. We have just started opening our office in Obakawaye Park, one of the best parks that exist in the country, in fact in West Africa.
Wow.
And so those high population or density, those high population dense areas, we enter those places so that when they get emergency or something happen, we can quickly respond. And then we also tell them about health insurance. If you look at that Obakawaye Park, for example, the inflow and outflow of people there is over 10,000 people. So if we're able to get to that place, open our offices there, people will know that health insurance exists. And every Thursday of every week, across the 3 senatorial districts, Edo South, Edo Central, and Edo North, we do what they call market storm.
Okay.
You know, we'll go to Oba Market, we'll go to Ekiosa Market, we'll go to Jatu Market, different markets.
What about Selu Market?
Selu Market. I'm just talking about the 3 central districts. We'll go across board. So we have a schedule. This week we'll go this market, the other week we'll go that market. And so by the end of the year, because of that schedule, we'll be able to cover all the markets and at least go at a minimum number of twice. All right, because there's a study to show that once you want many people join you, you would have spoken to them at least 3 or 4 times to convince them before they come onto your scheme. And that's not whatsoever where we are stopping. After talking to them on the health insurance scheme, this highly densely populated area will look for the health facilities where they're closest to them, so that when they get problem, they fit go there. And we'll set up ambulances where we go there around those areas, so that it will be a close distance. You're like, if you call and say you get emergency, you're not going to wait 20 minutes before the ambulance comes. On our system, we know where all our cars there. So the closest way they there, just be like the way 911 day for abroad.
Yes.
You call 911, say you get problem. The call and control center go look for their back end. Will say, okay, one policeman they near your area, this one they near your area, and in that thing, that's what we are doing in those states as well. So if you did any of the local markets or any of the highly densely populated area for our state, you get challenged. Our numbers there across board. If you look most of our billboard, you'll see inquiry and complaint number.
Yes.
Once you can call those numbers, for us, emergency is key. And so we know they wait whether you are enrolled in the scheme or not. Once they call us an emergency, they will quickly deploy our surge team there, make sure that we stabilize the person before we start talking of financing. And so that's what we have been doing. Presently in Edo State, as we're just talking, we just had a meeting for our monthly management meeting. We had 44 emergencies this month. 44 emergencies across our 210 centers that we've been able to remedy, that we're able to stabilize. Those are 44 avoidable deaths. And so kudos again goes to Governor Obaseki for setting up this Edo State Health Insurance Scheme.
Wow. Thank you very much, sir. Edo people, and say a lot of work dey ground. We be say our amiable Governor Godwin Obaseki, he don't put for ground. And this work no go fit manifest if you not get better people when you go help and manage am. Somebody say, one of the use pidgin English. That's what they say. Now talk am as it be, so that the mama when they deal Selu market, when they deal layer, they go the hear waiting with the talk. So as my God don't talk about the market, I want to talk about school. School won't resume. by the grace of God. Wetin be una plan to say make sure say most of those major schools across the state so una get una own meeting point in case of any emergency. They say that pikin play ball, he fall, he break leg, oh they push am. Wetin be una plan to take control am? Because I notice most of these schools they not get hospital or mini clinic to take address that issue. Wetin be una plan, sir?
Okay, and thank you again for that beautiful question. If we had our flyer, I would have showed you something now. Our flyer says that we have 5 different plans.
Okay.
We have the student plan, we have the equity plan, we have the tertiary plan,
okay,
and we have the private enhanced plan. So if you look at one part on our flyer, it says student plan. You see student plan 18,000.
Okay.
All right. So if you go again in what I said when I was describing our formal sector,
yes, sir.
It cover Papa, mother, and 4 children.
Okay.
At you turn 18, we expect that that's the age where you enter university. Or if you don't enter university, you go and learn a particular trade. All right, either a carpenter, artisans, or whatever you learn. We expect that you go there to do that. All right, so whatever way you fall in, you are a student, whether you are learning a trade or whether you are in university or whether you are in the polytechnic. Now, for those in the university and the polytechnic, this plan is divided across their school fees.
Wow.
And they pay it twice a year. They divide it. For those who are working with people who are employed, the employer can decide to say, okay, for this 18,000 naira, I'm going to pay it for you because you have been a good staff for me.
Okay.
Or you can say, okay, just the way Governor Obaseki is doing it, I'm going to pay 50-50 for you. Since you are working for me, let me cover 50% of your healthcare and you cover 50% of our healthcare. And so the people come into the scheme like that. So when you are a student, whether you are in session or out of session, as long as you have subscribed into the student plan, we always give you care. So as a student, for example, if you're in university, you go to attend the sick bay or the clinic where they of school.
Okay.
All right. But when you are out of session, you can go to any of our facilities within those areas. But if you don't stay in Benin, say you stay in Lagos, Abuja, or Port Harcourt, we also have an arrangement with them, especially for those 3 states where I just mentioned now, because we have done something we call interoperability.
Okay.
So if you did sick for those areas, they will tell you, say, oh, you come from a state health insurance scheme. Our commission and our agency, they
work together.
We are working together. So at the end of the month, they will treat you wherever you are. At the end of the month, they will send our claims to us and we'll pay them. That's how we've been able to get around the student health plan. But what makes the student health plan more beautiful is that each school, each facility, we have given them the level of participation so that they take their healthcare into their hands.
Okay.
We started with Edo State University, Uzuari.
Okay.
There's a tertiary health implementation committee that comprises some of our staff and some of their staff. All right, they say na person where they work out, na where they should they pay them. And so if we are not going to decide for them, but because they know their facilities, they know the pain point. So they know the infrastructural upgrade they need, they know the manpower deficit they need the drugs that they need, they know the prevalence of disease that are there. So it is our staff and their people that are comprised of the team, so that when there's something they need to do that is outside the work plan, they can quickly do it without even coming to us.
Okay.
So what our responsibility is to sort of give them policies and work together with the Ministry of Health to regulate what services they are giving to them. And so if you see what Edo State University is doing now for their students, it is what we are going to replicate across all tertiary institutes, so that they will have a committee to decide how many doctors do we need, how many nurses do we need, how many drugs do we need, what laboratory investigation or laboratory equipment do we need to meet the demand of our students and our staff. And we have seen that when you are strengthening health system across the industry, it is when the people who are taking care of their health, when the people who are taking care of the facilities are involved in their care, that you have the best outcome. And so that's what we are doing across the tertiary institute, especially for the universities, the Ekeadolo, Agric, and all those school of technology, and even across the school of nursing in everywhere, in every region in Edo State.
Okay, you talk about Uzare. What about Ekpoma? Because since you don't start for Uzare University, what about Ekpoma? What about College of Education, Ekeadolo, and Igwebe and Abudu? Because this one are another major institution. So what is on a plan concerning those areas we never talk about? So
you see why I talked about Uzuari was that they were the first to come on board.
Okay.
We started first with Ekpoma, but because of the problems that they've been facing, AAU strike, there were a lot of volatility with the students in terms of uprising and their student fees. So we're able to start with Edo State University Uzuari.
Okay.
We actually started with Ekpoma, but implementation started first with Uzuari.
Okay.
And because of the successes we're having with Uzuari, we know that we can replicate that across board. Okay. So the committee we set up in Uzuari, the Tertiary Health Institution Planning Committee, we also have set up one in Ekpoma University as we speak. As we speak, we've enrolled about 20-something thousand plus people in Ekpoma. But because their new session starts around the first week of June, that's why we are going to roll it out so that it will be for every school calendar year. We have taken their names in our back end now, the staff and students. We have started a minimal upgrade with their healthcare facility within the school. And so, just like I talked about Edo State University, we are doing that in Ekpoma, we are doing that in Ekiadolo, we are doing that in most tertiary institutes, even the School of Nursing, Technology, Agric, we are doing that. For those who do not have sick bay close to them, we use facilities that are closest to them. All right. If you look at the School of Nursing now, for example, we are taking care of their healthcare needs. All right. Even though they have a sick bay within the school can take care of their primary needs. There's another hospital outside of their school. When they require a doctor or more specialist care, and the ambulance will just go take the student from where they are sick to that place. It's less than 2 kilometers. In fact, about 1.2 kilometers, just around the same vicinity. They go there and take healthcare. So it is that same model we are replicating. In the NHS system abroad, the Obamacare, the Medicare, in fact, even the police system, when you have a challenge, your district or your regional hospital takes care of you first. And if they cannot take care, if it's a secondary care, they refer you outside. Or if it's a more specialist care, specialist intervention, they look at the profile of all the doctors within our health service provider network and say, okay, this one is a cardiologist, this one is a gastroenterologist, and so these are the kind of care you need, and they send you there. All right? It is this cross collaboration between the various health sectors, the Ministry of Health, the Health Management Agency, the Primary Health Development Board. It is this cross collaboration that we are doing that is making us get these successes. And because of our accountability and transparency framework, which we have imbibed in the culture for Edo State Health Insurance Commission.
Wow. My people, now this kind of thing we talk about, when we dey get the right information about what they happen for government, we no go dey complain. The reason why a lot of people they complain be say they don't they get the right information, don't they get better update. That's the reason why team go and verify. We say we go try to make sure say we bridge in the gap between the government and the people so that they go to get the right information. I beg, anywhere you dey, no forget to share the broadcast. Share them for all WhatsApp group, share them for all Facebook group, so that they go also follow up to ask questions about Edo Health Insurance Commission. Sir, I beg, like what you don't talk now, our people, they comply, whether home or abroad, they don't comply. How they don't comply? How it be? Our people don't follow up, because if they know they follow up, it just be like say we just they do the thing for grant. So that's why I want to ask you this question. They don't follow up. If they know they follow up, waiting, you know say they responsible, and the area where you know say they we also need to push out the narrative.
Again, thank you again for that beautiful question. We had a session with the National Health Insurance Agency 2 months ago, and we were awarded the fastest growing health insurance scheme in Nigeria.
Wow.
The reason we did that was that I don't want to also take credit for all the intelligence we have done, because we did not start early. We looked at what the industry have been doing for some time. Okay. And so where they had faults, where they floundered, we took a different step. And where they had their successes, we just simply align into it. So sometimes delay is also progress. All right, it's not every delay that is bad. And so, but because we have a good team and we have think tank in the commission, we're always ready to take criticism. We're always ready to take questions. We have been getting better because of this knowledge reinforcement we are doing. Again, people can enroll at the comfort of their home. We have something called self-enrollment. When you go to our website, with your phone, with your laptop, you can enroll from their home. And we've been getting a lot of compliments, a lot of inquiries, a lot of positive answers, especially from those in diaspora who want to enroll their parents. When we give them their website, they just go take their picture, enroll, and they can start getting healthcare. But for those who are not very IT savvy, so you can come to our office at the Block B Secretariat, Civil Secretariat Building on Saple Road, where we can simply enroll. It takes a 5-minute process. We enroll you, we capture you based on the plan you want to get in, and we allocate you to a particular facility or a hospital that you'll be getting care. All right. Apart from that, when you are enrolled into the scheme, we also do outreaches for our enrollees. Okay. All right. You know that there's a lot of outflux or exodus of medical professionals from Saudi Arabia to the Americas to Europe. All right. That's why the law came in recently of banning medical professionals from serving abroad. But what we have said to all our facilities is that we want them to do medical outreaches, to people to tell them about their healthcare needs.
Yeah.
If you remember, we had a Get Fit program at the Samuel
Yes.
Stadium about a week ago.
Yeah.
The reason we are doing that, we want people to take their healthcare needs in their hands. We are saying now that preventive medicine is better than treatment. All right, you can actually prevent any complication. And how do you prevent, illness from coming to you? You have to do regular exercise.
Wow.
You have to sleep well. You
Eat
have to
well.
know the kind of diet you eat. You have to be very hygienic. You have to wash your hand. All right. You have to know genetic predispose. What genetic your genetic predispose you to.
Yeah.
Does your father have hypertension? Does your mother have diabetes? Once you have some of those history, you know that this thing is not far from here. You can start taking care of yourself before then. A lot of the things we do, we eat, our activities can prevent some of these illnesses. And that's what the Edo State Health Insurance is doing, to tell them that if you take care of this preventive medicine before time, if you take care of these health needs before time, this good health seeking behavior, you will not come down with illnesses. And you will not have needs to spend some of this money in the facility. So for us, it is better we prevent the illness than spending the money in the end. Well, we're not oblivious of spending the money, but we just want you to take care of it, have a quality lifestyle, have a quality life, and also give your best outcome to Edo State, because we know that there's a slogan, a popular slogan, wealthy nation, healthy nation.
Yeah.
So if you are healthy, you'll be able to be productive in your nation. And so since we started, we've been able to at least prevent a lot of avoidable death. We're able to prevent a lot of complications and physical and permanent disability from complications that would have ensued if they didn't go to the facility before they got sick. And we'll continue to do that before we get our universal health coverage.
Wow. Before we round up this broadcast this afternoon or this evening, and took a question, the question, sir.
Apart from the website, do they have an
app?
Yeah, app.
Oh yes. We have a website. We also have an app.
Okay.
The app is for self-enrollment. The website is to know what is on ground. If you look at the website, it can give you a list of the facilities. Presently today, we have about 220 facilities on our scheme. About 78 of them are private, and 100 plus of them are public facilities. And all these facilities are just not hospitals. We have diagnostic centers.
Yeah.
All right. So if you go to a hospital, they don't have the diagnostic center. You can take your car and go to that place and do your full blood count or do your X-rays at no cost. We also have empaneled pharmacists.
Wow.
As a doctor, for example, when I fall sick, the first place I go to is not the hospital. Sometimes I go to the pharmacy to go and buy drugs. And so we've also empaneled pharmacists to say, if you're sick, once you've seen a doctor, you can take your prescription to that pharmacy and take your drug free of charge. All right, so it's not just hospital.
Well, free of charge?
Yes, especially if you have gone to a hospital and they've given you a prescription. The hospital is supposed to give you your drugs.
Yes, sir.
Now, if the drugs are not available in the hospital, you go to that pharmacy that we have empaneled. They take your drug, they write your name down. At the end of the day, it's not free, but they submit their claims to us and we pay them, but you have gone home without paying for your drug.
Wow.
Another question is, what's the plan for those of us after bypass, after road, for ambulance, government hospital, etc.? The private hospital at bypass have no NHIS, and still our part of the hospital is not ready for use.
Okay, there are a lot of hospitals after bypass and even before bypass. All right. Like I said, we are in the 18 local government of the state, which I think is laudable. We're in the regional offices. We have a surge team in Edo North, we have a surge team in Edo Central, and also in Edo South. Our totality of our staff strength stands at over 120 today, and we are still employing more because of the peculiarities of what we do. The ambulance service, like I said, is something that is in the framework, is in development. But there are hospitals across the 18 local government. So whether you live in bypass before or after, there are hospitals to take care of you. Whether you live in far reach of Umode local government, where there was no hospital before we started, now there are hospitals. If you live in Orion, Wankoko, Edo, Igwebe, whichever you live, we are hospitals. And those hospitals have been empaneled based on the set prerequisites: manpower, materials, ambient space, drugs. All right, those facilities will be accredited or empaneled into the scheme based on the pass mark or guidelines we've set. If they pass those guidelines, we put them onto the scheme, and people can visit there at little or no cost. Don't forget, the health insurance is not an insurance to cover all illnesses, but it covers basic major illness 24/7. When I mean 24/7, most of our hospitals, unless you work 24 hours in a day, we will not empanel you because people fall sick at bizarre times, and so you expect that once you go there will be a health service provider to attend to you. So most of our hospitals are 24/7 service. The ones who are not 24/7 service, at least there will be a nurse or someone to attend to you, and then they will also have telemedicine services to talk to the professionals if they are not on ground there.
Wow. Thank you very much, sir.
Thank you very much.
He get one primary healthcare center for Odigwetwe. I go that village about 2 years ago. Yeah, about 2 years now. So we'll go install solar lights. That primary healthcare center, nothing there again. The body building still there. So I don't know. I don't know. So I just make I bring down to your notice. Say social hospital there Odigwetwe like that. The building still there. A guest staff quarter. But the roof doesn't fall, nothing there again. But I would like, after this broadcast, or anytime, make you carry waka, go Odigwetwe, make you go see things for yourself. Yes, Odigwetwe. So they get the building, everything there, the roof doesn't pull. So that people for that exit from Osasiomba, they'll feel good that place. They don't need to bring them come town. So I beg you look that hospital. May go see how it be. But before we call off this broadcast this afternoon, how many primary health care facility we don't get currently for Edo? Currently, so many days, so many villages, at least you know feed everywhere at the same time. But I know say with time, we go reach so many areas. But currently, how many primary health care center we get for Edo now with the function?
Okay, in Edo State, we have over 456 primary health care centers.
Wow.
All right. But when Governor Obaseki came, one of his vision was that we have 192 wards, and we must have at least one functional primary health care center in each ward, which comes down to about 192 primary health care center.
Wow.
But again, we looked at the peculiarity. We said, sir, this your initiative is very good to have one primary health care center
per ward.
Per ward. But there are some local government, there are some wards are very big. Look at Oredo Ward 2, for example. It's bigger than some local government.
That's
true.
Oredo
Ward 2 is bigger than Igwebe local government. All right, there are some local government. You go, Akoko Edo, there's some ward in Akoko Edo. They are bigger than some other local government. And so we came down and said, okay, yes, one is good, but for some of these local government, can they have 2? Can they have 3? And he aligned with us to say some of those big local government can have more than 2 or 3.
Wow.
So what we started with one functional primary healthcare center across the 192 local governments. All right. Presently today, I said we have 220 facilities.
200.
But we have accredited over 100 plus primary health centers. Don't forget there's 70 something private healthcare facilities. So we have accredited 100 plus. Why we did that was that, like you said you went to one hospital at the Gwetwe.
Yes.
It was overgrown with weed.
Yeah.
Nobody did their roof did there. Roof not did there. We have also seen the same thing across a lot of primary healthcare centers. And so, because we are doing health insurance, we didn't want to break down our standard. We didn't want to say, okay, yes, government don't pay us. If you not get roof more, they pay you, make the money the entire. But we said no. For those who have been able to maintain their standard over time, yes, their standard must have reduced because of no maintenance.
Yeah.
But let us start with those who are functional. And we started paying them. We have seen that some of the facilities we started with a year ago, it is not the way we started they are now.
Wow.
Because some facilities at the end of the month earn between 200 to 500,000. So if you are in a facility where there's no roof and you have earned 500,000 for 3 months, you should be able to do your roof. If you're in a facility where you have no doctor or no nurse for the past 3 months and you have been earning 500,000, you should be able to employ an ad hoc staff or ad hoc doctor to start taking care of those people. If you're in a facility that the security or the borehole is not working and you have earned 500,000 each month, amounting to about 1.5 or 2 million per month, you should be able to do some intervention. It is this semi-autonomy we are talking about, about healthcare system. What Governor Obaseki's vision of saying a healthcare facility should be able to say and say, what is my priority need? Is it infrastructure? Is it drug? Whatever we need. Can we have minimal investment there so that the place can become functional? And that's what we are doing. Presently today, we have over 190 functional PHCs in the state.
Wow. And
by God's grace, we are going to increase it so that at least every ward we have one, and the wards are very big, we have more than 2 or 3.
Wow, my people. Belejo dey sweet me because information they say it is very powerful. And by the grace of God, sir, with my little time, we be say I sit waka follow a Sopadek, I discover say they build so many hospitals. I don't know whether they officially hand over this primary health care to una. Some day for Ukoromo, Ugoneki, so many when they are aware of because I don't go those areas. So I don't know whether they don't officially hand over this facility to una. We be say a Sopadek they build. They don't build and do everything. I don't know. Make you find out. I don't know.
And again, I want to use this opportunity to also thank the management of Sopadek. They've been doing a lot for us. But when we came on board, we had to realign our focus and our policies. Because what we realized in the past government was that they were not taking priority with what they needed.
Wow.
And so they were just building, all right? We have come to realize that it's the intangible that takes care of the tangible. If you go and build a place without people manning it, it's as good as having nothing. And so we're now in collaboration with the Primary Health Agency and the SOPADE to say, if you are going to build for us, please come to us. Let us look at the people's health needs, and we'll tell you what requirement is there.
Okay.
All right. We are looking for people intervention impact project, so that when you go to that area, what facility you build, it will be those people need. Because there are areas, if you look at riverine areas, for example, in Ovia, if you look at the prevalence of diseases there, you see that a lot of them have river blindness. That's because they are close to the river and because of the peculiarity of their environment. So if a SOPADEC is going to come and build something for us, we know the kind of specialists we want there. Of course, we want an ophthalmologist. We want an optometrist. So those are the things we are telling the SOPADEC. And since we've started meeting with them, they've been very gracious in listening to what we have been doing. They've handed a few to us, but I still know that there are still some few that will still hand over to us. So what we are doing with the Primary Health Agency now is to develop a framework of rotational work mode, so that a doctor who lives maybe 10 or 20 kilometers in a place, even though he doesn't reside there, can go to that particular area on a particular day, where we can announce to those people that, hey, a gynecologist is coming here, or an endocrinologist is coming, or a cardiologist is coming here. So please, for those who have surgical or gynecological problems, please gather yourself on Wednesday. The doctor will be here. And so you see, while we're rationalizing this manpower, you see that healthcare will be going across our facilities. And you see that even those primary healthcare centers that were not functional will become functional because the doctors are rationalizing them, we're incentivizing them from going there. The people in that area are also getting the healthcare that they require.
Wow. Okay, I better speak up and they hear you.
Some people said, how can they benefit when they are not salary earners?
Yes, again, it's a very beautiful question. I was talking about inclusivity, and I said we have stratified the society in various ways. Whether you're a salary earner in government coffers, or whether you're a salary earner in private healthcare people, or in a private place, you are entitled to healthcare. All right, the health insurance is not just for government people, but for Edo citizens, Edo residents rather. If you look at our plans again, you will see that we have costed everything from 12,000 to 18,000, 35,000, 68,000, and 75,000. So those who are not salary earners, for example, their employers can pay for them, or those who are self-employed, they can pay for them. For those who don't have salary at all, we regard them as vulnerable in society. Remember when I started, I said, the reason, the major backbone why the health insurance was set up was because the Bible, even the Bible acknowledges that the poor will always be with us. And so the poor doesn't mean that our lives are more important than they are. The life of God, the life that God has given to us, everybody is very important. And so we are taking care of the vulnerable. So whether you are a salary earner or not, as long as you are a resident in Edo State, we have drawn up a framework. Some of the questions we ask some of those people who are not salary earners, we ask them, where do you live? All right, we want to know which area they live, whether they live in a desolate area. We ask them, how many people in your family are educated? Do you have a professor? Do you have a landed property? Do you have a farm? It's an indirect way to find out what kind of luxury assets they have, or what kind of income, possible income they can get every month. Once you ask those questions, the people who are poor, they'll score a particular number. The people who are also rich score a particular number. So at the end of the exercise, you can determine those who are poor and those who are not poor, just by answering indirect questions. And for those who are poor, of course, government is providing for them.
Wow.
Government, those state government and federal government is providing for them through what we call the Basic Healthcare Provision Fund. On that scheme today, we have 46,000 people we are covering for free.
46,000?
46,000 people covering for free. And just recently, the governor just approved that we should add another 20 to 30,000 on top. In fact, I was just talking of yesterday. Yesterday, was approved that we should add another 20 to 30,000 upon.
Wow.
So in the very nearest future, we are going to see another extra 20 to 30,000 of people who are vulnerable, people who are not paying anything, but are getting healthcare service when they require it.
Wow. And people say the government no dey work. See, my people, government work not all about do road and red roof. It is beyond road and red roof. We're not there against red roof. We're not there against road. But there are so many key areas where they be say they eat money, and now Governor Gordon Obaseki, they put in money. Governor, now God go bless you. My people, if we say make we continue, we go still there here till tomorrow. But by the grace of God, we will create another time. We'll come back again, make Oga DG tell us progress so far and their next plan, so that Edo people will get the right information about what thing that they do concerning Edo State Health Insurance Commission. Very, very important, sir. Some of our people for diaspora, when you watch some of our interview with one of your staff, they ask questions. They say, now which of them they enjoy for abroad be this? Now, Governor Obaseki, they carry come Edo. Say what these people know they say, they know they sham. Now say they sham, but they just pretend they don't want sham. But by the grace of God, through this commission, team go and verify, we go make sure una sham. And as una sham, una go enroll. I beg. Somebody say, you know they enjoy money when pay. You they pray make you sick. You don't need to pray make you sick. So not be in my way one they enjoy. But the truth be say, sickness, they don't they plan for them. So I beg, make una try, make una enroll. Our musician, our mechanic, our furniture, bricklayer, I beg, those are the say kuli where they push wheelbarrow. Make una enroll. Now for our own benefit, it is very, very important. Before we go let Oga talk to us generally and their next plan so that these get fit. I like that get fit that day. So if plan day, so that make everybody carry Waka Con Stadium, so that make we begin to get fit. Very, very important.
Thank you very much, Apostle, for coming here to interview us on what we have been doing in the Edo State Health Insurance Scheme. I want to use this medium to appeal to all Edo citizens and residents that Edo State Health Insurance Scheme is here for you, is here for everybody. It is a non-partisan scheme. It's a non-religious scheme. What I mean by non-religious is not affiliated to any religion. Whether you're a Muslim, Christian, or practicing African or traditional religion, you're also supposed to be part of the scheme. Whether you're educated or not, whether you're physically disabled or not, this scheme is for everybody in Edo State. Whether you earn salary or not, this scheme is for everybody in Edo State. Our aim in Edo State is to achieve universal health coverage through paying and non-paying enrollees. I want to use this medium again to thank Governor Gordon Obaseki for also always trying to be our GPS, for guiding us, for giving us direction on how to increase the coverage, and for making sure that the quality of service across the hospitals in Edo State are top-notch. One of the beautiful things that also happened is that the Ministry of Health is now a regulatory agency, and you can hear recently there's still some hospitals that have not been giving quality of care to our people. And we say with the minimal investment that we have given, with the minimal manpower we have, we expect that Edo residents will be able to reduce in the dimensions of physical and permanent disability, and also to reduce avoidable death. So I once again use this medium to endear everybody to please find a way to Edo State Health Insurance Scheme. You can register on our self-service through edostate.edohis.com, or you can come to our Civil Secretariat building on Block B, 8th floor to come and get registered. We also have our numbers and our inquiry. I'm sure it will be displayed on the screen. Also, complaint number. You can call us if you need direction on how to register the scheme, on how to register on the scheme. We'll have readily available search team who's ready to answer you. We also have our call center that works 24/7, and so when you call, there will be somebody who will be readily available to talk to you and speak to you on your journey map how to get registered on the scheme. The scheme is for you and I. The scheme is for us. Support us in what we are doing, and please be ready to get on the scheme. If you have challenges, we'll be ready to answer you. Once again, thank you very much for having me on the show.
Yes, my people. Now God will bless all of you now. Edo is truly becoming great again. But remember, Edo cannot become great if we not join hands together with the state government. Make we join with the state government so that Edo will become great again. Remember, make you bath, make you wash your hand, so you go make you day neat, because cleanliness is next to godliness. Very, very important. Wash your hand as doctor, don't talk him. I dey very happy, my dog. You do well. Now God go bless you, Dr. Rock. You do well. When it be say, you say, God don't bless me. I want to contribute my own quota to the development of the state. You know, say, I beg, I know they come. But you come to call, answer the call to duty. So, my people, I beg, as Dr. Rock still come still contribute your own quota. All of them always did that. Probably say God don't still bless when I get data health profession. Make can also come still partner with Dr. Rock so that Edo will become great again. And no say a lot of our person get hospital for abroad. When I also get equipment. When I want carry come Edo to contribute. I beg, when I also carry and come to donate. Very, very important, because if this hand was this hand, nine hand they clean. Because one hand no go feel remove eyes for head. When I do well, God will bless all of you now. Edo is truly becoming great again. Remember, my name is Apostle Alfred Odion. Oh, you know, sir, my dog.
Thank you very much for having me on the show. Thank you, Apostle. God bless.
God bless you guys. Bye for now.
arise, sons and daughters of the land. The king of the city is marching. Stand up high to the pride of the land. The founding fathers have labored, and our time to serve is now. The glory of the new Edo nation will forever be our pride. Beautiful Edo, glorious Edo, you're the heartbeat of Nigeria. Beautiful Edo, glorious Edo, stars are singing over you. You're the land people dream to be. Our treasures are found in all nations.
Now we don't hear from Apostle Alfred Uyinosa and Dr. Rock Amego. Let us know what you think for comment section. If you never subscribe to Dan ARG YouTube, try make you subscribe so that make you for the hear all the things where they happen for Nigeria. Make I leave you with this video, make you help us share them. Thank you for watching Dan ARG YouTube.